young lady, accept. The law states that 17.5-year-old is not yet up to 18, and so that one lacks the capacity to consent. And so it's sexual assault. Whether it was based on mutual agreement, so it's non-consensual, it is important to state that. Now, if it is rape, it is a form of assault. If it is attempted rape, now this is where the problem is. The survivor is able to prove evidence of attempt, right? Not necessarily that it occurred. It is still sexual assault, right? Okay, so other forms exist.
Other examples like fondling, that has to do with touching of the child's private parts in a sexual manner, and forcing a person to perform sexual acts against their will. These are all examples of sexual assault.
Yes. Fine. Okay, so now we've looked at sexual assault as a form of sexual violence, right? And in that we talked about non-consensual. Now, for rape, because we talked about attempted rape in the previous slide, for rape, there is penetration, no matter how slight, right? Of any of the orifices, vaginal orifice, anal orifice, even oral penetration, right? By part or whole of whatever. Even if the perpetrator uses ruler, it is rape. Even if the perpetrator uses biro, it is rape, right? Provided consent was not given. Now, the issue in pediatrics is that, just conclude, the child cannot give consent. The child cannot give consent. So any form of penetration, either by the sex organ of the perpetrator or whatever the perpetrator uses, his finger, biro, whatever, that is rape. Now, rape can occur, right?
We have types of rape, which stranger rape and acquaintance rape. So for stranger rape, this is a case whereby from kidnapping, armed robbery, the perpetrator has no direct relationship with the survivor or victim. While acquaintance rape, they have a close personal relationship or sexual relationship.
Good. Okay. So this occurs when people go for parties, right? Party after party, date rape. So the use of gamma hydroxybutyric acid is known as a condition. Oh, let me go out. So I'm taking maybe my whatever, maybe what do we call it, juice, and it's kept. And okay, let me just go and answer a pick phone call outside, or because it's noisy, and the music, maybe the video's music is blasting. I just go and ease myself, and the person drops something. Not me, not me. God forbid. So now, gamma hydroxybutyric acid, flunitrazepam, ketamine, alcohol, all these stimulants can be used to sedate, so drug pass. So it just knocks off the other person, right? So they're present. Because if consciousness, so the person compulsive eating. We know that food will not resist. Food will not resist. So the person was overpowered, and so the person overpowers food and overeats and becomes obese, right? And then we know that human papilloma virus is a virus that can be transferred, is mostly transferred by sexual contact. And in these young girls, you know, HPV vaccine, right? The age of 9 to 14 years. So let's get them vaccinated. So causing cervical cancer by transmission of human papilloma virus. Well, the other mental health complications are things we've talked about: depression, post-traumatic stress disorder, right? So others,
substance abuse, increased risk of suicide, feeling lack of worthlessness actually.
So just imagine the trauma of sexual abuse and subsequently suicide. I mean, that's real trouble. Okay, so now how does trauma affect brain function? We want to know, right? We are doctors, we are scientists, we see them. So there is a disequilibrium of the nervous system, so that it tilts the survivor to another mode, which we call the stress response mode. So we will look at the stress responses. When the person is tilted to a stress response mode and unfortunately remains in that mode based on how the person adapts, right? Now, provided we find somebody in that stress response mode, the person can be triggered by whatever simulates the initial trigger. So continued trauma trigger state, so that survivor continues to respond to triggers like noise and remains perpetually in the state of fear. So if we look at these pictures we have here, if we look at the diagram we have, so this is the diagram of the human brain, and this is a prefrontal cortex in a brain that is not stressed, right? This is just like stress that occurs with any kind of, but an emphasis on the stress following sexual trauma, sexual violence, right? Thoughts. There's a tight control of thoughts, emotions, and actions. These three things go in disarray when sexual abuse occurs. So there's a linear transmission to various parts of the cerebral cortex, the brain, where this should be integrated, right? Is well controlled. But look at this. Once there's a trauma, the signals are weaker, disoriented, and so thoughts, emotions, and actions go haywire. So what are these responses? I'm sure we know some of them already.
So the trauma responses, there are four F's actually. Fight, flight, freeze, and fawn. So for fight, they said self-preservation through conflict. That's a way of being self-defensive, getting anger outburst, while flight has to do with protection through escape. So the person is trying to escape from their current reality and find other things to distract him or herself with. Freeze is a sort of self-preservation through dissociation, trying to
lives in a different world.
Exactly.
As if it didn't occur. Okay,
well, so for fawn is self-preservation through placation.
So let's see more detailed examples.
So for flight, like we earlier said, the person is trying to leave the current reality. Most of them, you find them, they are workaholics, they are overthinkers. It's important to know that the female rape survivors should be placed in the autotomy position or the knee chest position, which will help us to view the posterior hymen and the perianal area. For the male rape survivors, it's important to put them in a supine position while examining. It's important to also carefully inspect the pelvic, the genital, and the perianal areas.
Yes. Okay. So this still on forensic examination. It's important that any evidence we can get, say we keep photographs, we keep diagrams, right? So that it will serve for us. Now, we know that if we want to enhance visibility, acute examination, use of toluidine blue, right, because it enhances visualization of micro trauma, right, that may not be really, really obvious. Now, even though they are coming to maybe the general practitioner or maybe the pediatrician, but colposcopy is most within the domain of the gynecologist, right? So this is where teamwork comes in. It's multidisciplinary. Even though we know that we must respect privacy, but then we need expert involvement.
So, laboratory evaluation of rape. Within 8 to 12 hours, if indicated by the history, the urine and the blood sample for date rape drugs like ketamine, lopinol should be taken. Now, within 24 hours, the blood for comprehensive drug toxicology should be taken to be able to screen for other classes of drugs. But within 72 hours or up to 96 hours, depending on the protocol used, it's important to take samples to screen for HIV and for syphilis.
Yeah, HIV, syphilis, or hepatitis B, and all that. Yeah. So timing of presentation really matters. Yeah. For cases of date rape, right, it has to be as early as 8 hours. Else, it will be difficult to prove that, right? So, and then within the treatment, so we're able to screen treatment. It's recommended that STI prophylaxis is given, right? It is recommended. We have the evidence for it. So ceftriaxone, the dose is there, plus doxycycline, and in females, metronidazole. So these 3 drugs, ceftriaxone as a single dose, doxycycline, right, and then metronidazole. Now, pregnancy prophylaxis is also indicated, emergency contraceptive with levonorgestrel, right? And then vaccination history for those HPV, so that if it is a window of opportunity that we give, right? Okay. So,
okay, the indications for sexually transmitted infection screening in children with suspected sexual abuse. So in a case whereby the child has experienced penetration or there is evidence of recent or healed penetrative injuries to the genitals. Also, if the child has been abused by a stranger, it's important to screen for STIs. Or the child has been abused by an assailant or perpetrator, yes, known to be infected with STI or high risk. Also, children that live in areas with high rates of STIs in the community too.
Yeah. So when the child has some symptoms that are somehow, for example, vaginal discharge, genital pain, the child's gait, the child is avoiding, you understand? So genital itching, odor, all those ones, it's important to go all out to screen. So STI diagnosis, treatment, reporting. There are some that you need to make the diagnosis and you report. Well, we report all cases, but the strength of what we are talking about. For HIV, we have the diagnostic test. For things like chlamydia trachomatis is diagnostic. But by the time there is genital herpes, if you suspect it, you look at differentials you consider to report, right? Okay, so this is algorithm for post-exposure prophylaxis, right, for survivors. So we are looking at the extent of risk. The risk substantial, is the risk negligible, right? Now, whether it is substantial or negligible depends on what fluid and what contact the fluid makes, and then the source of who releases that fluid. So let's see, let's just break it down. If the person is presenting less than or equal to 72 hours, right, and the source is known to be HIV positive, then post-exposure prophylaxis is needed. If the person is presenting less than 72 hours, but we do not know the HIV status of the patient, then we do case-by-case definition. Now, it is substantial risk if mucosal surfaces like the vaginal rectum, eye, oral is what is exposed, and the kind of fluid, semen, blood, vaginal secretions, rectal secretions, breast milk, whatever, right, it's retrieved from somebody who is HIV positive, then the person serves post-exposure prophylaxis, right? But if the presentation is more than 72 hours, right, and there's negligible risk to the surface. All right, so if the kind of fluid is urine, nasal secretion, saliva, those ones are of less priority, right? So those ones we may not recommend post-exposure prophylaxis. So we're gradually coming to the end of the medical aspect of treatment.
And we all know that follow-up visits is very important. So obviously to monitor the psychosocial progress and to also support the STI screening tests like HIV, syphilis, and hepatitis B. In some cases, most of the children don't present with symptoms on time, but by the time they present for follow-up visits, they notice the discharge and so on. Also, to counsel them for hepatitis B vaccination and HPV, human papillomavirus vaccination, for children greater than 9 years, if they were not adequately vaccinated.
Yeah.
And in a case whereby they notice the child has mental or
like acute stress disorder, post-traumatic stress disorder.
It's important to the mental health professionals to address the trauma.
Yeah. It's okay. So to address the trauma, so let's look at trauma-informed medical care. So this is a comprehensive approach that beyond the medical care giving, we want to identify the impact of the trauma on the physical, mental, social functioning of the life, the quality of life of the survivor. So the aim is to prevent re-traumatization. So we are able to identify what has happened so that we avoid re-traumatization. In trauma-informed care, it matters a lot how the healthcare worker interacts with the patient, in this case, which is the survivor. We do not ask questions like, what is wrong with you? No, that is outdated. It's what happened to you, right? Now, that kind of question gives an opportunity for the person to pour out the person's mind. And at the end of it all, what is best for you? What do you want? So it is like a survival-centered approach in the care of these trauma victims, right? So what is concept of re-traumatization? Whatever replaces the trauma, right? Whatever makes the victim get into that mode of flight, fight, fun, or fright, whatever of them. So it's important that we know, because it's associated with emotions, bodily response, replaying the original experience.
Even by the words of the guardian or the parents too.
Yeah.
Maybe saying, oh, why will you wear this thing? See what you are wearing. No wonder this happened to you. So we are trying our best to prevent such, to the concept known as re-traumatization. We're trying to prevent it.
Yes. I want to prevent it. So we want trauma-focused therapy, right? So it's focused on the trauma victim and not just of some preconceived. So the person in front of you is the person you are taking care of, right? And want to support as much as possible. Wow. So we are wrapping up our presentation, and we've talked a lot about the physical manifestations, what we need to do about screening, what we need to do about treatment, that's physical health. We want to know when to identify the mental trauma and refer to the mental health experts And also we want to see how we want to prevent trauma-centered care. We want to prevent re-traumatization. But
it's not enough.
It's not enough. That is the point. No, even if I do all this, it's not enough. So you know that ignorance of the law is not an excuse. Ignorance of the law of the perpetrator is not an excuse. Ignorance of the law for the healthcare practitioner is not an excuse. Ignorance of the law for the bystander, the parent who was aware and didn't do anything, is not an excuse. Let's make some progress.
So, as healthcare workers, pediatricians, anybody who cares for children, the parents, the guardians, it is important that we must file a report, especially when you have suspected a case of sexual abuse. You don't need to gather too many evidence or too much evidence before you present to the law enforcement agency, that's the police, with such a report.
Yeah. So we say the legal threshold is low. So he said, it's a national registration agency. If you see something, say something. Trust your instinct. It is better investigated and found that no, it wasn't, right, than one is quiet about it. We are not waiting to gather evidence conclusively. We want to take care of the physical problem. We want to gather the evidence we can gather, and then the law swings in. So we report. So it is the duty of the police or the child protection, sexual welfare officers to investigate. Investigation is not to report to the police or the law enforcement agency any case of known or suspected child abuse amount. This must be reported. So what are the cases of child abuse and maltreatment? It could be physical, it could be sexual, it could be neglect, it could be psychological abuse, unlawful sexual intercourse, that's rape, right? Whatever is seen, it is mandated, it is not optional, that the healthcare worker or the adult reports. Good. So, but is it always done? We'll get to know that, but what are the steps?
The step one is oral reporting. You need to report orally, like to the police.
Yes.
Secondly, by a written report of a detailed history of what happened. Then reporting obligations to the perpetrator or person in charge of the concerned organization of abuse.
So this is made simple for everybody to understand. So the law, so anybody practicing must have access with the law enforcement agency. Oh, I have so and so. Now, we are not waiting for the full written report because this must follow within the first 72 hours anyway, right? So we are reporting the name of the survivor or the victim, the age, the gender, what happened, where it happened, right? Good. The name of the assailant, if it is known, because we know we talked about stranger rape and acquaintance rape. So for the stranger rape, we may not know, right? But the acquaintance rape, the person will know who he is, what's his name, where he stays, did it occur in a school setting? These are reported orally. Then it follows within some 2 hours, regardless of public holiday or weekend. right? The perpetrator is reported. Now, then just like a written information was sent to law enforcement, the organization where it occurred gets a notification. Yeah, so do we all report? At this point, I just want to pause the presentation and ask a question. Can I see your answers in the Q&A? Has anybody reported a case of sexual assault in the past? Let's give some few seconds and wait for responses. Q&A, let's see your responses, please. We've not had any yet. Oh, nobody has reported. None of our esteemed participants yet. Nobody has reported. Wow, this is interesting. This is interesting. So let's see why. Why then? What are the barriers to mandatory reporting?
Well, a lot of healthcare workers or people at large are ignorant about the whole reporting of such cases, and there's some form of apathy, like lack of interest. Well, because they feel like much won't be done. Even if you report, what would they do? Maybe because there are other cases of children with similar issues, and people even went as far as protesting and try to get justice for them. And at the end of the day, nothing was really brought to light. Yes, so a lot of people actually don't show interest.
Yeah, so people don't know, but when we got to this, we said ignorance of the law is not an excuse. It's not an excuse, but then a lot of people are actually ignorant, and that's why we are making this webinar to enlighten people. Then there is apathy. Some people who send, only me that kind of a thing. Then fear of physical or legal reprisal, right? So we have these reports, even from US, that there's a fear that there could be a reprisal. Okay, so well, we just flash this. Our listeners will get the slides at the end of our presentation, right? So these are contacts that can be reported to. Yeah, so let's switch to our wig and gown at this point. The position of the Constitution of the Federal Republic of Nigeria.
So this helps, it promotes and protects the rights of every member of the society, including the vulnerable members.
Yeah, so we'll share the slides. We'll share. All right.
So this actually promotes and protects the rights of every member or individual of the society, including the vulnerable members, the victims, the survivors of sexual abuse. So chapter 4, section 33 to 46, it actually has to do, everybody has the right to dignity of human person. Yes. And in a case whereby such rights are violated, it is important that it's brought to court of law.
Yeah. So this is regardless of the gender or the age. So remember, we're talking of child sexual violence, right? So regardless of the gender or the age, the dignity and the rights of that person must be protected. Violation of any of these, infringement on this is liable to litigation. Yeah. So the Child Rights Act, interestingly, was signed into law. I think has been passed into law in all, so child's right law, right? It's an act that becomes a law by all the states in the Federal Republic of Nigeria, although we have some regions that have different explanations, different depths to it, but we're not talking about that here. So we have section 31 that says the child's rapist is liable on conviction to life imprisonment, right? So I hope we are able to get this done. Now, but subsection 3 of section 31, where a person is charged with the offense under this section, it does not matter whether the offender believed that the person that was sexually abused was less than 18. That's why we earlier said,
above, yes.
Yeah, was above 18. That's why we said, even if the girl was 17 years 11 months, right? You know, some of them, because they a lot of Indomie. They look really, really big, right? Because whether it was with consent of the child, because a child legally cannot give consent. So you're talking of the child agreed. Agreed is not strong enough under the law. So
Section 32, it has to do with any person who sexually abuses or even exploits, as we earlier mentioned, a child. It doesn't need to be in what we mentioned, the manner at which we mentioned. The person is liable to conviction to imprisonment for a term of 14 years.
Yes, yes, whatever it is. Good. So let's make progress. Yeah. So the Criminal Code Act. So we look at the Criminal Code Act and the Penal Code, right? So the Criminal Code these are old legal documents. They've been there, right, for the southern part of Nigeria, while the Penal Code is for the northern part. Now, we will see why are we looking at this and what is a way out. We said the Child Rights Act, it suffered a lot of delay in signing. But thank God to our former Minister of Women Affairs, Mrs. Pauline Talent, she insisted it was signed into law. But we said that various regions have different depths to the understanding and implementation. So this also, we said this is for southern part of Nigeria, right? So it defines its own rape, bearing the assumption that the victim is always a female. Forgetting the fact that the victim can be a male, right? And also assuming the assailant is always a male, forgetting, not bearing in consideration that it could be a female. So this is the definition, as you can see. But whatever the definition of rape that was used, any person who commits the offense is liable to imprisonment for life, with or without caning, flogging the person. So you flog the person and the person rots in jail, right? Good. So this is for rape. The beautiful aspect of the Criminal Code Act is that there is also punishment for attempted rape. Because attempted rape, even though it is not rape, is a form of sexual assault. Any person who attempts to commit the offense is guilty of felony and liable to imprisonment for 14 years, with or without caning. Okay, so attempted rape, it was attempted, but it did not occur. You flog the person, the assailant, and the person rests for 14 years in jail. Now, the Penal Code law, which is for the northern part of, because see how old it is, right? A good number of our participants were not born at that time. Not the presenters anyway. All right, so section 282 of the Penal Code provides for the offense of rape. Again, it has a similar definition of rape that looks like what was found in the Criminal Code, right? Now, it also states the penalty under section 283. Whoever commits rape shall be punished. That is good enough. With imprisonment for life. Good punishment. Now, the issue is that, or for any term that is less than imprisonment for life, shall also be liable to fine. So it means, whereas the Criminal Code states that it's imprisonment for life, for this, it could be imprisonment for life, it could be imprisonment for 2 days, and it could be fine of 500 naira. Now, see the disparity. Of these disparities, the Violence Against Persons Prohibition Law was said. Now, this is the original document, from Kwara State, but this is similitude of what happens generally. So the Violence Against People's Act, Violence Against Persons Prohibition Act, was signed into law, right, as at 2020, quite recent. So it has a broader definition of rape as A person commits the offense of rape if he or she intentionally penetrates the vagina, the anus, or mouth of another person with any part of his or her body, whatever part, or anything else, be it ruler, be it pencil. Do you understand? The other person does not give consent to the penetration. Consent is not there, right? Good. And consent is obtained if it was obtained by force or threat, whatever, right? It is rape. A person convicted of the offense under Section 1 is liable to a minimum of 20 years imprisonment without the option of fine, right? Good. So whether the offender is less than 14 years of age, this is where our concept of innocent exploration. So this is where our concept of innocent exploration may not be absolutely innocent, right? Because we said when the offender is a child, right, it's seen a little differently. And that's why that person does not go for life imprisonment. Where the offender is less than 14 years of age, the offender is liable to a maximum of 10 years imprisonment. In the case of rape by 2 or more people, I mean, that's life imprisonment, right? Good. Fine.
In conclusion, sexual violence against children is both, like we earlier said, it's like a multidisciplinary approach. It's both a medical, mental health, and a legal issue. Legal attention is important, such as mandatory reporting, violence against persons prohibition law, child rights acts, and the criminal code.
Yeah.
Now, it's also important to create awareness, public awareness, and support where necessary to protect the Nigerian child.
So just like we are doing in this way. Yes. Okay. So we have recommendations to our dear listeners as we round up this webinar today, that we will know this and the public to be aware that victim blaming is not acceptable. It is not an offense to be a child. It's not an offense to be vulnerable. It's not an offense to be dependable, right? To be a dependent, right? So there is a register from the Violence Against Persons Prohibition Law, naming and shaming of perpetrators. That's it.
It's important to bring them to light.
Yes.
Everybody would be aware.
Yeah, so we know. So now we have a lot of laws. So we moved from, we talked about, okay, in fact, the Constitution of the Federal Republic of Nigeria, we talked about the Child Rights Act, we talked about the Penal Code from the north, and then the Criminal Code from southern part of the country. But the current one is the Violence Against Persons Prohibition. This exists now. It should be implemented, right?
Also, it's important to teach children about good self-esteem. It's like sex education, more or less.
Yes.
To let them know when it's inappropriate to touch their private parts.
Yeah.
And what constitutes sexual abuse, who, how, and where to report to.
Yes. So it's important because some children do not know. So fondling is not acceptable. Yeah, it's not acceptable, right? So whatever it is, a child is supposed to have a good self-esteem. I do not accept. Uncle touched me this way. I did not accept, but he went ahead. The child should be able to report. And then we think that it's just like we are having this webinar practitioners. There should be periodic training of the police, right? On emotional and psychological trauma of the survivor, so that they avoid re-traumatization and mockery of the survivor. Like, oh, it happened, who asked you to go out? You, this young lady, see what you wore, see when you are coming back. Now, that is totally unacceptable. We want to thank our dear listeners for hanging on, and we've come to the end of our presentation today. We do not know if you have questions. If you do, please put it in the Q&A section. We will gladly answer you. Okay, thank you for your participation. We'll get a broadcast from one of us shortly. Okay, thank you. So we round up our presentation of the August edition of the webinar from the Limit Children's Hospital. We shall still have other sessions coming up in due time. And our sister branch, the Cardio Care Hospital, will have a webinar advertised shortly. Thank you.